friend me Frank Osei Kwekudwamna. Me a natural medicine researcher and health campaigner. Na for some time now me suffer peptic ulcer. Okwan ebitimi afa so a de nipedua no fa so a etimi na peptic ulcer. Na me be cheche mama you say na yefun eye na adwuma ne okwan ase fa so a etimi na peptic ulcer. Na this part of the series no and I say video no babeka okwan ebitimi afa so asa peptic ulcer and I say ebitimi treat peptic ulcer with foods and say na me can be a research and I'm a line of research maybe I'm mentioning can say nutritional medicine okwan ebitimi afa so di nnuane ne ndro kasi nnuane ndro ebeka obrofo me say food supplements no asa yare and I say treat yare na say na mebo nipedua no obo nipedua ne say nipedua ne ntimi ne de enhele ne ho but say nipedua ne betimi ahele ne ho na enam nnuane ayedi so say na me de nnuane ndro egu nnuane ayedi no nti say ye wo yare bi wo ha yare nnuane mo say wugya edi ana nnuane bi won so a wudi a itime boa speed the healing process and I say the healing mechanisms of the body no itime speeding up ama wutimi nya ayaresa na obi wa ba yare na ubenu medru a teacher abofo ndro benu ma na yare na enye de enko na igina eduane a wudi eno so nti enen e ba be hwe enwuma bi of course ye wo herbal side and I say herbal medicine and I say be kan say ihaban ene ihaba bia ebetimi ende ama ebetimi aboa obi a okun peptic ulcer but eno de ye mfa nto efidie so say ofra ebetimi ene waka ho asem na de be ka ho asem e we efidie so ne nnuane bi a odi a ebetimi aboa no it should be part of your daily activity and I say your lifestyle nima ye kan nya nyoma obey no dakro pe na wejaye that be it should be part of you isa say nipa ye dide bia nti say nnuane ebubo so na say baba ebubo so no so nnuane ye say utadi so wo bi awo ulcer na so person prevent ulcer ye say utadi say nnuane no e be boa for the stomach no nti no yen sembre no ye be hwe textbook of natural medicine human part 2 na yen hwe ne a okafa the kind fiber and the topic peptic ulcer duodenal and gastric no can be before fiber I say a diet rich in fiber and low in refined sugar is associated with a reduced rate of duodenal ulcers as compared with a low fiber diet. Let me repeat, say a diet rich in fiber and low in refined sugar is associated with a reduced rate of duodenal ulcers as compared with a low fiber diet. So I can say ubia otadi nnuane a fiber aye ne ma no say nipa no you ubia on time nya and I say in conformity say no mon time nya stomach ulcer and say peptic ulcer e ka say fiber ne that e be can say potassium e be can say roughages and I say sapo nti me ka say isusu ano bia we anka say men nu nso ni pro wi mu ne ka ho saa emu no roughages na body no ehia na e friend fiber no nti o say obi o tadi no na fiber wo mu no e obi a on tanya ulcer because ye fun no the digestive tract no stomach ne ka ho no any intestines no ehia saa fiber na dia yedwuma nti wodi nnuane a fiber ni ma na odi asemankasa na eba body ni and I say eba also video bi wo ha ma ya afa your friend is saying fiber, the effect of fiber on our health. Wait me I download this video now watch me kasa fiber nnuane a yi dia fiber ni or how a dey brain nipa ya adwen ne den enko so nti na say obi a odi nnuane a fiber wo mu no on time na ulcer nti say the therapeutic use of a high fiber diet in patients with recently healed duodenal ulcers reduce the reoccurrence rate by half nti obi a owo ulcer especially duodenal ulcer the fiber treating no say fiber no say ulcer no kwa ensan ba biem ulcer na bi mo wo mu treat kwa na asan ba obi a ye de ne fi hospital ba fi na ye san de na akọ but say obi odi duane a fiber wo mu bebre no say ulcer no kwa en time ba dem hwe de nti okaso say this is probably a result of fiber's ability to delay gastric emptying of the liquid phase, counteracting the rapid movement of this phase into the duodenum. which is normally seen in ulcer patients. Nti deɛ ɔka wɔ ha ne sɛ ɔsi sɛ wodi aduane a fiber ɛnim a aduane a fiber ɛnim no one thing ne sɛ yɛfunu digesting ntɛm na efi yɛfunu no because fiber ɛnim nti yɛka sɛ aduane a fiber ɛnim ebi ne brodo esiam aduane refined carbohydrates no pastries white rice no sɛ aduane na fiber ɛnim ano no ɔsi yɛfunu digesting ntɛm ɛno nti na ɔmo wɔ diabetes anaasɛ ɔmo yɛ diabetic yɛsɛ ɔmo ndi sɛ aduane because yɛfunu digesting ntɛm na release sugar na ɛwɔ mu no fast into the bloodstream tema sugar no rise ntɛm nti ɔmo di aduane a fiber ɛnim no ntɛm na yɛfunu digesting ntɛm a na ɛkɔ wɔ deɛ ɔdu ne mu no ana ɛkɔ mu with together with the acid no nti sɛ fiber no wɔ aduane mu deɛ a yɛfunu take time ɛde nyam no yie nti ansa na ɛbɛdu deɛ ɔdu ne mu no na acid na no ayɛ den abra ase saa na wei na ɛkyerɛn wɔ ha nti sɛ digesting ntɛm na ɛkɔ a because of sɛ digesting ntɛm nti acid no ano den no ka ho na ɛde afiri aduane a ɛde kɔ deɛ ɔdu ne mu no stomach lining ne bi nim nti wei no yɛ especially ɔmo munya duodenal ulcers no so wodi aduane a fiber ɛnim a ebetumi ama wonya duodenal ulcer because deɛ ɔdu ne mu no lining anaasɛ stomach mucous membrane ebi ne deɛ ɔdu ne mu no ebi nim a ɛbɛ protect acid no acid no mucous membrane deɛ yɛfunu mu pɛ na ɛwɔ yɛni deɛ ɔdu ne mu nti sɛ aduane no a wodi ne fiber nim na ɛde ntɛm nkɔ a together with the acid no ebema ebenya ulcer ɛwɔ deɛ ɔdu ne mu nti no ase although several fibers often used to supplement the diet have been shown to produce beneficial effects, a diet rich in plant food is best. Nti ha no ɔka sɛ though yɛwɔ supplement bi fiber supplement of course ɛna adebia meta ka no yɛwɔ other supplement bi timi de aboa ofra anaasɛ contact na ebetimi aboa o but the auditor to say a diet rich in plant foods is best. It is all per fiber. You say we take the plant foods. It in the case of plant foods you know my natural and your pastries and your refined carbohydrates, white rice and your junky foods that when you come as diet, the plant diet. Hence no we run consume they all have enough fibers. You di by fiber womb on your body fiber womb would di ben kukunte. No say ni na high fiber foods. Na junk foods ni edi. And fiber ni remember we na problem. This way you be a who treat also say woman we do an time be an rich in fiber. And I feel so if you never acquire na say plant ba acquire no so body wa ha and also boa obi a owo stomach ulcer and also peptic ulcer all cabbage cabbage nso another vegetable and hwehwemu akyerɛ sɛ ɛno nso timi fight peptic ulcer nti ɔsɛ okay under cabbage ɔsɛ raw cabbage juice has been well documented as having remarkable success in treating peptic ulcers. 1 liter per day of the fresh juice taken in divided doses resulted in total ulcer healing in an average of only 10 days. Nti ɔsɛ cabbage juice raw cabbage juice nti ɔsɛ there's a well document omode ato ɛkyerɛ sɛ cabbage juice have remarkable success in treating peptic ulcers. To say 1 liter per day of fresh juice taken in divided doses. 1 liter of cabbage juice taken in divided, so be divided in kakra. So we cabbage juice 1 liter na obenum kakra. Also resulted in ulcer healing, total ulcer healing in average of only 10 days. Hence cabbage ade atimi esa ulcer pan but make sure say ubenya the organic one. The organic one are yenfa chemicals we anya den engugu so na say we use so say we say we use adanchine and I say friend say vinegar e dey aru hu ye ansa na we use na no so come problem. Also further research has shown that the high glutamine content of the juice is probably responsible for the efficacy of cabbage in treating these ulcers. Nti o say bibi wo cabbage na friend glutamine or say a cabbage no a woman pan of course you other bibi crucifix family cabbage ne kan ho ye wo other in Arabia no so was family man ni na was glutamine but o say cabbage no say glutamine content no then high na eno na etimi eboa obi a owo ulcer itimi healing ulcer ne man. Of course there was supplement wo ha no so glutamine no ma train fi cabbage nim no supplement when say we na cabbage na contact bit me na supplement no bi ayɛ den ama wɔn nso ɛbɛboa wɔ ama yɛtumi ahele ulcer. Nti ɔsɛ in a double-blind clinical study of 57 patients, 24 using 1.6 grams a day of glutamine and the rest using conventional therapy, that is antacid, antispasmodics, diet, milk, and a bland diet. Glutamine proved to be more effective treatment. One half of the glutamine patients showed complete healing according to the radiographic analysis within 2 weeks, and the 22 of the 24 showed complete relief and healing within 4 weeks. You can say, no more information, be research into nipa glutamine na what cabbage mu say ebimu show complete healing, ebimu use only 2 weeks, complete healing comparing to na ye mom abrofundro no comparing to na ye mom abrofundro no nti eduro anase nwura ba kwa na say eduane ba kwa itimi ulcer cabbage obetimi dey for ye di but say we dey treat ulcer dey say o blend na onom o blend na ma body nitimi fa ntem assimilation no ye quick body nitimi den use ntem dey den esa no yare and I think so in addition cabbage family thiocyanate like sulfurin have shown considerable activity against H. pylori. Nti no ka say bibi nso san wo cabbage ne ma itimi H. pylori mboa na ye ka no bi hu say H. pylori no nso ye mboa bi omode ulcer ba asa H. pylori so person wutu ase a eradicate o ma o say ade ba kwa no so timi o mo cabbage ni timi mo pa. Nti o say in one double blind study, 8 pylori infected patients were randomly assigned to feeding of broccoli sprouts. Broccoli is another cabbage family maybe. And it was 70 grams day containing 420 ml of sulfurin for 8 weeks, or to consumption of an equal weight of alfalfa sprouts not containing sulfurin as placebo. Intervention with broccoli sprouts but not with placebo decrease the levels of urea measured by the urea breath rest test and 8 pylori to antigen. And what can I know about using cabbage family to heal ulcer? I need to more studies be more cabbage family and maybe extract the woman and I say blended them more total healing. If it's a share healthy body human man, that is Dr. Pamplona, healthy body human man can be for and also can be for cabbage into say eradication. I say conventional treatment for eradication of Helicobacter from the stomach includes antagonists and several antibiotics combined. These treatments tend to be effective, but there are resistant cases in which the bacteria persist in the stomach. Into a case, ye 2 H. pylori one fear phone. I say normally orthodox drugs and also orthodox treatment they only use antibiotics and other antagonist treatment effective, but I say it to the beer and one it may resist it, and also resistance to the ingredient. To go up no hospital do nana and co be a one more say do hospital do the beer antacid or no friend say me proud or those in do no more or was but one man any the and continue and one it to grow resistance. But however, I say all foods or plants mentioned hereafter have been shown to be effective against Helicobacter and are useful to complement conventional treatment for eradication of the bacteria. Into hands or can you anibia or babu boswa or say effective. It is say even crowd use to above from no same and I say they come with Diana. I know better what to your and I say I and Sambabi. Into the can of broccoli. Huma textbook for natural medicine and also can cabbage once and broccoli no say another family of the cabbage fruits, and as a cabbage family, broccoli in the count. And I some can find broccoli. I see broccoli. I say according to a study by the Tokyo University of Science, Japan, eating 70 grams of broccoli florets for 2 months can reduce the bacterial colonization of Helicobacter pylori by 50%, in addition to soothing gastritis. It was say we will be I say research bi omo wo Tokyo University of Science Japan omo chese say we obi a udi 70 grams of broccoli na vegetable we obi a udi 70% grams of broccoli for about 2 months na say we obi a wo 8 calorie ni bi o say yare no 8 calorie money tini if you ni produce about 50%. And I say both broccoli and cabbage as well as other plants in the cruciferous family are effective against Helicobacter due to their high content of sulfurin, an antioxidant and anti-carcinogenic substance. And so I say that is the cruciferous family. Because the cruciferous family now, that is cabbage, broccoli, sprout, and so I say almost some substance in my friend sulfurin. Now say substance antioxidant and anti-carcinogenic it may eradicate H. pylori no efi uyefun nim it is cabbage I think so be no cabbage broccoli no enu nie we na e friend no broccoli no vegetable anya na kra wodwam it no betimi akọ bi ato na ode aboa wo ho it is nnuane we mu no se se utedi a itimi ulcer no papa na afi nso no ye wo ade ba ko nso no timi H. pylori mo ano eno so se onya bebo honey ewo meka se ewo a obi anim ewo nso ye ade ba kwa etimi ulcer emwa ne yi na se H. pylori emwa na omko se ulcer ne yi nti o kan say the antibacterial effect of honey has also been shown against Helicobacter pylori. This has been confirmed by research done with Manuka honey, a typical product of New Zealand. A teaspoon of honey, that is 5 to 10 grams half an hour before meal, can contribute to the eradication of Helicobacter. Nti ano ka say hwehwe mama ye na che say ewo enso timi H. pylori mwa ni nti H. pylori mwa ni bia say o tedi ewo na o say research bi omo ye na had your particular brand of honey, but say friend Manuka honey nti ubetimi apebi ubetimi apebi so onye bi so afra ubetimi ama obi nti o say sa honey no say onye bi a o say 5 grams and I say 10 grams teaspoon, that is a tray did no hwe ba kwa na me no gu enu ma be 1.5 hours na we did no and also betimi aboa etu H. pylori in one ase na afi o sambo garlic wa ha that is allium sativum nti o say garlic no nso no mayen kan your truffle garlic o say at the University of Castilla-La Mancha in Spain, garlic extract rich in allicin and thiophanate has been shown to be an effective inhibitor of the growth of Helicobacter pylori in vitro. Garlic oil is also effective. Nti hande o chene se hwehwe mo ye chese garlic bibi o my friend no allicin allicin na thiophanate sa no my wo garlic mu no se eno nso ya ade a eboa pa ma se wo H. pylori ni bia entimi ma omunyi emwani ni mo chance mo munyi wo yefun ni no ma omaba be cause damage to the mucous barrier no nti se garlic no obetimi dia fra we na garlic ya nwe no sa garlic no nso no ye nua so be garlic awe we no raw ba we na we no raw na nchese kofa garlic no tu onum na we da bi oyesa bi pram garlic no obetimi twetwe gu aduane so bia ubedidi emu ana bibi vegetables utwitwa garlic no guso na wa ye ne ese na twitwa je ne gu bibi so na ware no be bo na afensu ne ye wo garlic supplements eno nso no in the form of gel bia ne scent no untimi nwe a obetimi nso ato gel ne bi eno nso no ebeboa ma itu ulcer yare na se ana afi no cranberry no nso ye fruit. It was say the antibacterial effect of these berries on the germs that cause urinary tract infections has been studied extensively, but the studies done by Tokyo University School of Medicine, Japan, have shown that due to their polyphenol content, cranberries are also active against Helicobacter pylori, inhibiting their growth. These berries can be consumed fresh, a handful 2 or 3 times per day as juice, 2 or 3 glasses per day. Nti ano cranberry juice and as a cranberry eduaba na nkasa no o se eno nso ntwehwema mama yenche cranberry ankasa no so wo urinary tract infection we na infection wo urinary tract ma cranberry eno ye good itimi ntwehwema che se itimi yi sam one so but mama say hu se sa comp and say property na e wo sa cranberry no itimi yi sa infection wo urinary tract no mu no say saa nnoma na nso timi bua tu us Helicobacter pylori mmoawa no efi wiyefun no nti sɛ wonya cranberry juice no bia or say this berry can be consumed fresh or as juice. Nti juice no about 2 or 3 glasses a day for some time no so betimi aboa etu Helicobacter pylori no ase. And I feel of course we both be to say berries into the combination of cranberries with other berries rich in anthocyanins with high antioxidant power such as blueberries, berries, raspberries, strawberries has also been shown to be active against Helicobacter. Nti hano kind of combination of the other berries, nti fruit be a berries also be that berries. I say the combination of them no in the form of juice no. What I know no so betime itu Helicobacter pylori mmoawa no ase. If you or some can send you propolis they can baby say orthodox treatment now use to antibiotics and treat peptic ulcer. I think they be kum cronephians no be in one if you but at times they want it to me resist this orthodox treatment in Tibabe Obenum Abofunduna Nemko. But your natural antibiotic be a ejuma papa. Ejuma ye. Your friend of propolis and also be na ye. Be no more year one, it can't boy also. Be no almost be a friend of propolis. Propolis, no. No mana be no. Every year and more diner, or more year one woman. Any friend of propolis, no. Into be into no, the man can say be in a dino. Our more one woman, the boy be a one na a dino, and the dead demo, ye chin now we chin, and no more chin year one. So I didn't ye chin when you friend of propolis. It's very powerful, a natural antibiotic. I'm afraid no. Another name for it here, the nature's miracle. The nature's miracle. Now antibiotic, the AN say when it comes to orthodox antibiotic now, the orthodox antibiotic and say your bacteria is be where you to send American H. pylori no say bacteria and your bacteria is be where you you be a good and a being a good. You hear the good bacteria and send a bear no swear for digestion in intestines no. And then I didn't know what he has a good bacteria. And now, of course, you did your from another bacteria since Baby Fry from my end. Into the antibiotic and say a bacteria. But the orthodox bacteria antibiotics say both the good and the bad. It is all type of orthodox antibiotics antibiotics now. It will be no bit me around because the good now can say a keepy. Never for digestion orthodox antibiotics now then but when it comes to this natural antibiotic propolis now it protects the good bacteria now the intestines and also the digestive tract in here and we keep those good bacteria now eradicate the bad ones including the H. pylori no and into now omoye one now should be omoye one with the so down but say aboa bi antimi nra edan no nkose ye wo na say contaminate ye wo no is due to the properties of the propolis no nto say mamenka bi nfa propolis no say a natural antibiotic made by bees for their own needs from the resin and sap of various trees. Studies by the University of Messina, Italy show that propolis is very effective as a Helicobacter growth inhibitor, due to which it is recommended to complement to eradication treatment. It's in a hospital. I say almost research before propolis in the University of Messina, Italy. Now, the way say propolis, very good. Preventing one moment, and at the same time, and also research upon research on propolis, and just a healing property. Then they can antibiotics and also kumkro. It's natural antibiotic and a kumkro. It's a kuna babeda yumukrampona. Propolis never boa for the healing. And then we are not a boss. Of course, super propolis may be now contact a bit inside then I can do it in so as other health shops be maybe now on the asam a natural antibiotic in this side effect be a bit in use a beb wow and see winning a new boss on the next video no so na best I share in human be and also say yeah a bit in up why might be 2 or say as and you know a Frank Jamina Frank was a quick Jamina my YouTube channel near from them. Now, betting I subscribe it. No, call YouTube number from them now. waiting to subscribe with the YouTube name now. Obe like every time you do new videos, better will be on it will pop up on your screens. Now obe to so I share. I'm a for so I should be number no 0546335569. Who health challenge be now here in where be as nutritional counseling. Send your bit to me, EDD, EDD to your area. Obe to me after now and also about us.